Hi, my name is Elizabeth. I am a professional clinical counselor as well as a licensed drug and alcohol counselor. I have my master's degree in co-occurring disorders, meaning I have a lot of education and experience with addiction and mental health. My professional experience includes adults with developmental disabilities, addiction, mental health issues, and mandated treatment. I've been working with men and women who are on parole for the past 5 years with sex offenses. My self therapy includes CBT, DBT, and with an Adlerian approach. I like to get down to the root of the problem, which I believe are the cognitive distortions, which we all have, and finding ways to rewrite those beliefs in a more positive pro-social manner. This will sometimes include you having homework in sessions that you will bring back the next session or work on throughout the month. I like to make little goals with my clients to work out throughout the month as well. Moving on to informed consent. I know this is a mandatory treatment set by parole in the state of California, meaning the parole has access to reports and notes taken about our sessions. I will have to report all violations of parole conditions to your agent, but I'll always talk to you first about it and maybe figure out a way that you could tell them first and then I'll follow up. I just want to let you know parole doesn't go through our session notes or any notes taken, and I don't go contact them about every session. They usually don't really care what happens in session unless there's a violation, so I like to keep what goes on in session pretty private unless there's a need to know basis. And I have to report how you're doing every few months when your containment comes up. Sometimes I'll have to talk in supervision, group supervision, and individual supervision with the people in this company that you've almost met all of them about your case, but I only bring up the necessary details. I don't tell them about everything that goes down, and I'll keep your name out of it as possible. And this is just so if I have a problem or I need another person's experience or expertise, advice about something that just to better help our treatment and my treatment towards you or for you. I have to keep a record of all our sessions together and note any unusual activity, drug use, any risks to yourself or others. And I have to report those risks to yourself or of you wanting to hurt yourself or others. But overall, my session notes just kind of include what we've been talking about within the session and just how you are that day. I keep track of all your treatment progress and the goals you're moving towards and lowering your risk. But this being a professional relationship, I do not allow clients to text me, add me or look me up on social media, call me outside of appropriate work hours, which are 8 a.m. to 8 p.m. on weekends. You're always able to leave me a voicemail, and I will get back to you as soon as possible. And then for titration and termination, our therapy will titrate when you have shown that you are doing well and your calculated risk scores are lowered to normal levels. It will completely terminate when you end parole, but it can continue if you need help afterwards.